So the initial goal is we want to be able to get into this spot safely. So how do we do that? There's a couple of tricks that we can use. One of them is to measure, right? So if we measure the distance between the surface that we're entering and the top of that canal, that's going to be about 5 millimeters, okay? Now, why this is significant, and again, we can't necessarily do this in a clinical tooth because we can't see through it, but I want to give you the sense of it in this view so that when you look at it clinically, you have a great sense of the lesson here. So 5 millimeters. So what I like to do in that situation is come back to my burr, okay? So now I'm going to take my burr, and what I'm going to like to do is I want to also measure this, right? So I want to measure what 5 millimeters would look like on this burr. So when you look at it here, it's just about the head of the tip of the burr is there, and it's just about to where the shank changes width here. Okay, so right in this area right here. So that's going to be a perfect spot for me to first mark with a Sharpie. So what I like to do is do this pre-op, obviously a sterile burr. And what I'm going to do is I'm just going to come here, and this was an easy one because the marking happens to line up with the anatomy of the burr. But I'm just going to give it a little mark right here, just as an initial one. And then what I can do is I can spin the burr and mark the rest. So here what you'll see under the microscope is when I spin the burr and I put the Sharpie on there, we get a nice Sharpie line.